I can talk a little bit about, why it was created, because like you said, it does go back to 2009 and the debate over the Affordable Care Act. And I think at the time there were a lot of members in the Senate where I was working who wanted to find ways of bending the healthcare cost curve. And just as many members that wanted to think about healthcare spending as wanted to address the uninsured and expanded health coverage. And as staff, when we looked at policies to reduce health spending and increase quality, there really weren't enough ideas on the table that had been tested and could be implemented. And so the idea was to create this center that would generate new and test new approaches for payment and delivery system reform in Medicare and I think to a lesser extent Medicaid. And if they worked, they could be spread across the program. So were there ideas out there in the private sector that had been tried and tested that we ought to think about in Medicare? So I think that was the impetus for the creation and the rest is sort of history. The idea is to move our system away from fee-for-service and towards a health system that rewards value and better outcomes for patients. And so in the last 10 years, we've launched more than 50 alternative payment models and initiatives. And but only a handful of those have really generated the statistically significant savings I think that we might have envisioned when the center was created. And so after joining in March, what we've done is spent a lot of time looking more closely at those lessons, what we've learned from those 50 plus models, and how we need to focus our efforts going forward for the next decade.